Welcome and thanks for joining us for today's ASA webinar, Intimacy and Aging, How to Support Romance Across the Lifespan, which is part of the Empowering Professionals in Aging series presented by Home Instead. We will be getting started shortly. The slides for today's presentation are available under the tab on your screen labeled Resources. And under the tab labeled CE Application here, you will find information on how to obtain CE credit for this event. You will have 60 days to complete a continuing education application, and it may take up to 30 days from the date of your application in order for us to process and issue your CE credit. If you are not logged in directly to this webinar, that is, if you are watching as part of a group and did not log in using an individual confirmation URL, you will not be eligible for continuing education credit because we have no way to track your online attendance. If you'd like to receive continuing education credit, please be sure you log in using a confirmation URL you received after individually registering. If you have questions during this presentation, you can send those anytime using the questions box, and we will save those for the last 10 to 15 minutes of today's program. And now I'd like to welcome today's presenter. April Ibarra, MGS, is a gerontologist and strategic partnerships manager for Home Instead, with more than 25 years of experience in healthcare and aging. She is passionate about improving the lives of older adults through advocating, educating, and providing resources to help them live their highest quality, most independent life. I now will turn it over to April.
Well, thank you so much for that warm introduction, and hello, everyone. Thank you for joining me today. I will call you my brave attendees here to learn more about supporting romance across the lifespan. So we're going to have a really lively conversation about a topic that many people try to avoid thinking about or talking about, but not me. I am devoted to helping professionals in aging understand how vital it is to support intimate relationships amongst older adults, and also to inspire everyone who is aging to recognize and not ignore the importance of intimacy as we age. I believe that ignoring the importance of sexuality for older adults, if we do that, we fail to acknowledge the role that sexuality and intimacy plays in people's relationships, their health, their well-being, and their quality of life. So are you ready to get started? You know, when I came up with this title, we used the term romance because I don't think we wanted to quite use the word sex or sexuality. I tend to use, or probably will use, the word intimacy a little bit more because I think that really further defines what it is that we are talking about. Yes, that's me. My name is April. I am a gerontologist. I speak at everything really from the aging point of view. So I look at everything from how does this impact the older adults' lives, and then how do we best, approach this topic or anything that we present to the older adults from an aging perspective. So from that respect, I am an older and aging woman, so you'll get that point of view from me as well. But I am not I'm not a physician. I am not a sex therapist, but I am someone who is passionate about older adults and how we best support them so as they age, they do have the highest quality of life. So let's take a look here at the objectives. We want to, talk about the importance of emotional and physical, intimacy. And again, this is a subject that people tend to shy away from. You'll even see when we talk about the research that there's not that much out there. It's just been overlooked for so many reasons. But the impact on quality of life for older adults is imperative. We also need to talk about the diversity of the aging population and also how gender and sexual orientation may impact intimacy across the lifespan. We also need to explore some of the common concerns related to sexual activity and aging. We know as we age, there are changes. They also impact our ability to be intimate and sexual. And then we also want to kind of give a guide for professionals and also families so that they can best support the sexual health of older adults that they are taking care of. And ultimately, I think my goal is just to help everyone who's joined today to better understand the importance of this topic, maybe help you to be a little bit more open to understanding the needs of older adults, and then feeling comfortable and understanding what your role is. As if you're on this call, you might be a family caregiver, maybe you work in home care or long-term care. We all are interacting with older adults. We all have a role and a responsibility for being open to the value and the importance of this subject. So, yep, there are a lot of cartoons out there, a lot of funny things about sex, but let's face it, it also promotes a lot of ageism and stereotypes. And I think that's one of the bigger issues here. It's almost like a joke. These negative views are really, first of all, inappropriate. And even though they might be unintentional, they do start to set sort of a path of what is a common portrayal of seniors. And I think it tends to go either way. You either promote a stereotype where that older adult is oversexed. You think about, oh, that dirty old man or those types of statements. But then you also, on the other hand, can promote a concept that an older adult is no longer sexual. At what point in our lifespan do we suddenly just shut off our sexual personalities? It doesn't happen like that. So these stereotypes and this ageism can be very negative. And so I think we need to be cautious about that. And we also have to understand that with every older adult, everyone is different. So just because we have, one older adult with this belief system or this point of view on sex, the other older adult is completely different. So we want to be aware of that. And, there's so many programs out now that most that I have enjoyed, I have to admit, that really portray older adults, in some very, good ways and bad ways. But, they're on TV now. They're in different programs. I think of Frank and Gracie. I think about the Kaminsky Method, TV movies like The Book Club with Jane Fonda, Diane Keaton, with the aging population growing, we're going to see more and more. But the reality is it's not just one or the other. Older adults are not oversexed, they're not undersexed, they're just human beings who are aging, who also have sexual needs and intimacy needs. So let's keep that in mind as we go. Now, again, I mentioned before about sort of what's out there in terms of the literature, and, there's not a lot. The focus has primarily been on more about the biomedical approach. What happens physically as we age, and how does those changes impact our ability to be intimate or sexual? And of course, you have to think about when Viagra was first introduced to the market. Whoa, was that sort of a game changer? But that focus only on the biomedical and just addressing the ability to have sex or perform, in a sexual way, doesn't address the fact of what is important and how does, and I'll go back to the word intimacy because I think that's easier to sort of understand how somebody's need for intimacy can help their quality of life. So I hope to see more research. I think the topic is, I think it's interesting that we might say that it's controversial. Why is that? I think that goes back to biases and ageism. Everyone on this call is aging. And what I, would encourage you to do is think about why is it so difficult for us to think about older adult sexuality when every day we're getting older? At what point will we no longer see ourselves as human sexual beings? So let's just kind of bear that in mind as we go through. And I do think that so much of that uncomfortableness is what has led to a lack of research in this area. But hopefully that is changing. So let's talk about sex. It's a great song, by the way. I wish I could have played this in the podcast. When we talk about sex, it's not just the deed of sex. Everyone understands there are so many aspects to sex. Sex is the act, the mutual voluntary activity of two people having sexual contact or intercourse, but it's also the sexuality is an intrinsic, lifelong part of being a human being. And at 15 and 20, and you start to develop yourself as a woman or a man, you absolutely carry that sexuality with you. So, for example, if somebody was a very sexual person, very comfortable in their skin as a sexual human being, they will probably continue that. It doesn't mean that as someone is older that they're all of a sudden going to, start being or change their approach to what kind of a sexual being they are. It's a continuity. It goes back to the continuity theory of aging. We are who we are. Sometimes that gets, more impactful. Sometimes it diminishes a little bit, but overall, older adults are going to be the same throughout their lifespan. So why would it be any different as they're 60, 70, 80, 90, even 100? Sex and intimacy, again, it's the physical intimacy, emotional intimacy. So when we talk about sex, again, let's keep in mind more the term intimacy, where we're really talking about more than just the act of sex. And physical intimacy, I think we can all really think about how we all felt during COVID when we were disconnected from other people, when we couldn't hug our friends, we couldn't high five at work, we couldn't hold somebody's hand, we couldn't do these things unless we were, living there and confined in our space. I hope that helps us maybe to understand what impact that physical connection has. So as we think about sexuality in older adults, we want to think about how important that just being near somebody that you are close to. That could be a friend. That doesn't necessarily have to be your partner. It's the hugging, it's the connection. The emotional intimacy is equally as important. We all know how concerned every aging professional is about isolation. When people are isolated, they're not connected physically or emotionally. So, just kind of keep that in mind as we start to think about, how important it is for older people to have these connections and not to be concerned with, oh goodness, mom's got a new boyfriend and now she's having sex. Maybe it's more than that. Maybe it's just the fact that she needs those connections. So let's just keep an open mind with that as we go forward. So why are we even talking about this? I felt very strongly that this was just important because, again, for all the things we're talking about, and even though there's not a ton of literature around it, I think we can all agree having these connections, whether they're sexual or they're just intimate, romantic or hugging, touching, whatever, are important to the quality of life. We've got a lot of people who are aging, and this is only going to be more important. How do we continue to help people age as best as they can? They need to have and maintain some physical and intimate relationships. Our sexuality is where we experience who we are. So if we remove that from older adults, if we sort of try to help that or make that disappear by treating them as asexual people, what are we doing to that person's personality, to who they are, how they represent themselves in the world? We need them to be the person that they are, regardless of age, regardless of their sexual orientation, their gender. We all have a need for physical comfort, love, and status in continuing who we are in this world. We have to acknowledge that there has been a lot of changes in the aging population. As we're caring for older adults today, it's very likely, we have somebody who in their 80s, their experience and their marital history and their perhaps how they approach sexuality is completely different than the aging population that we're going to see tomorrow. Same way for all of us. I am on the baby boomer cusp. I'm a baby boomer. And I have, I'm currently married, but I have been divorced. So it's changing. We are looking at, a lot of different aspects. And when we think about intimacy, marital status will impact your ability and the likelihood that you'll have these connections. So we can see by these statistics that there's lots of changes going on, and not everybody is staying married. At least 9 in 10 older adults over age 60 have never been married. That's another thing, and a term that I'm not completely a fan of, but is the elder orphan, or somebody who's never been married or is divorced, who has no children. As we look at our aging population, we have to recognize the marital status and the marital history is changing. We're going to have more and more couples who are divorced, who are living with a companion or somebody, who are dispersed from their family, and that does change and impact quite a bit. So we need to keep that in mind. So the term gray divorce was coined several years ago, and basically it's the fact that, more people, as they become older, are getting divorced. It's no longer, we'll say it no longer has a stigma. It's very difficult. But more people are deciding that, it's okay for me to be divorced. I'm more comfortable with it now. It's become more mainstream. AARP is the one who studied this topic and presented some information on it. And it is a trend for adults over the age of 50. I have not seen statistics post-COVID, but everybody knows that what a challenge that was. And I think many people grew together, but many people also grew apart as they were forced to be, together indefinitely to really start to face some things. And I do think older adults now are more comfortable in deciding that, I'm going to live the best life that I can. I'm going to, take a chance and have a divorce, and it's not necessarily the stigma that it had perhaps years ago. As you can see there, the last bullet, for those over 65, the increase was even higher, and it roughly tripled in 25 years. So it's not uncommon that we're going to be dealing with older adults who are divorced. In the same vein, we're dealing with a very diverse older population. Now, when more people are openly gay, it's important that we recognize that this population is part of our aging clients and families. There's some great organizations out there that are dedicated to improving the lives of gay, bisexual, and transgender older adults. There's issues, as people are LGBT, but then there's specific issues that our older adults are facing as they age and are living the lives of a gay, bisexual, or transgender adult. What we have found when looking at that population is they are resilient because across their lifespan, they have had to deal with family rejection, employment discrimination, violence, and more. Perhaps it's better today, but I think it has improved. Today's older LGBT people are more likely to say that there is a more acceptance and that things have improved, but those who are in the younger bracket tend to disagree. But we have to recognize if we are dealing with clients who are in this category, it is our role and our responsibility to support their needs and their sexual orientation throughout their lifespan, just as we would any other client of ours. And that's difficult for some because there is biases and everybody brings their own, belief systems to this. But if we can just recognize that they do have rights and that their needs are different, their experiences are different, and how we treat them could make a big difference in their lives and how they approach their ability to still be intimate in their lifespan. Some facts about LGBT and aging. It's estimated that there are currently around 3 million LGBT adults over the age of 50. Of course, these have to be reported. Somebody has to ask this question. So according to everything I've read, it's not always the easiest data to measure, but we would say that there's still a large percentage of people who are living, and some of them who are living still quietly, unannounced, but many who are out there living as an LGBT adult. What they have experienced in their life really does impact them, especially as they enter and go through old age. Discrimination across their lifespan has had could possibly have a negative impact on their opportunities in education, employment, housing, and stability. So across that lifespan, as they have been fighting discrimination, and I don't think anybody can argue that there has been discrimination against LGBT folks, that likely some of the people who are older today have really been impacted financially from this discrimination across their life. They are more likely to be single and live alone. And as we've talked about with intimacy and connection, it's pretty important. The more larger your circle is, either a family or friends or spouse or grandchildren, so it puts them at greater risk for having less intimacy opportunities and less connections in their life. They're 4 times less likely to have children. They're more likely to have poverty and homelessness, and they are more likely to have poor physical and mental health. I really found some of this to be, well, first of all, I found it alarming and shocking. I have many friends who are LGBT, and I never considered what impact, I guess, all of these discriminations across their lifespan had possibly had. So if you weren't aware of that, I think it's good just to stop and take pause and really consider what can we do for our aging clients to best support them. We don't always have to agree. Anytime we're dealing with a diverse population, there's going to be so many different mindsets, but we do need to support and respect their needs as well as every client or family member that we have. So what are older adults saying about sex? Well, regardless of what we think, older people are having sex, they're talking about sex, and they're continuing their role as sexual human beings. And that's what the literature is saying. And again, there's not a ton out there, but most older adults, 76%, would agree that sex is an important part of the romantic relationship at any age. 84% of men agree, 69% of women agree. I think we could all agree that even as we age, men and women are still men and women. We're going to have different perspectives on the concept of sex and who wants what. But 2 in 5 or 40% indicated that they are currently sexually active. And we do know that sexual activity does decrease with age. That's not super surprising as we go through in a little bit and start to look at some of the implications that aging has on our ability to have sexual and intimate relationships. We'll be able to understand that better. But regardless, and I think it is important that we always kind of look at the aging population. in these different segments, because I personally am, I'm 57. So when people start saying people in their 50s are like this, when people in their 60s are like this, well, we can't do that, right? But certainly somebody who is 65 is going to have a much different perspective in all likelihood than somebody who is 80. So we do have to recognize those tiers of aging and how that does impact sexuality. All right. Sorry, I lost my cursor there for a second. Let's see. There we go. All right, let me go back just a second. Okay, and overall, we'll say that sex is important to my overall quality of life, according to some of the research that University of Michigan did. And, we can't get away from the fact, and I think this just highlights that we don't want to assume that older adults are not interested in sex. They are. And those with a romantic partner were more likely than those without a partner to agree, because as we start to look at some of the implications of aging, access and having a partner is pretty important. So anyway, let's take a look at that on the next slide. All right, so common issues that impact sexuality and aging. We could probably all make a list of these, but some of them might surprise you. We know that older adults are taking multiple medications, and that really does have an impact on their sexuality. And it could be perhaps an intimacy, but also just actual, the performance of sexual activity. Age-related changes. Sex hormones decrease, so women often report a lack of desire. Men often report erectile dysfunction. So we know that those things, if you have been, let's say you're a married couple, you've been sexual most of your life, and then you start to have these age-related changes, they will impact the sexuality aspect of the relationship. Doesn't mean they can't be, addressed, but certainly it does make changes. Alcohol and drugs, that's regardless of any age, will impact our ability. Loss of partner. We often hear the stories of somebody who has been married for 50, 60 years. You lose that partner, you lose your intimacy. And not that they don't recover, but that does change. It does impact their ability to have sexual partners. Many people are surprised, when dad, loses his wife, and then goes out and starts dating another woman. Those are hard things to deal with. But many times they want to replace or still continue to have that intimacy, even though they have lost a partner. Lack of privacy is a big one. In long-term care and senior living communities, we often don't consider the fact that privacy is important. Or perhaps you've moved your mom or dad or your grandma to live with you, and you sort of neglect to remember that privacy is important for everyone. So again, just another issue that impacts sexuality and aging. Certainly dementia is very important. And that does get complicated as we start to look at the ability to consent to sexuality. So for those of you who are dealing with residents in long-term care, you're certainly going to, have something to say about this topic. And it is important and vital that we support sexuality and intimacy, but we also have to understand how dementia or even some of the medications may impact someone's approach or their behaviors. So that's kind of a big deal. Shifts to other forms of intimacy. Again, across the lifespan, not everyone remains, sexual in the same way that they did when they were young. So they're going to maybe shift to other forms. Maybe holding hands, watching TV at night is a form of intimacy. It's still an important form of intimacy. Even if they're no longer sexual, that connection, that kissing, that hugging, that touching another human being. Again, we talked about COVID and how many of us were disconnected. Not everyone had families. So if they were isolated and working from home, they were alone. And I can guarantee you that there was a lot of feelings of loneliness, isolation, possibly even depression. So imagine how an older adult feels who has that sustained in their life because they don't have access to intimacy and connections. And then a final one that we have to address is really just attitudes about aging. If someone is made to feel like you're too old to think about sex, to have sex, to talk about sex, to want sex, how is that going to make that older adult feel? And some people, based on culture, perhaps religion, their own life experiences, feel that maybe it's not appropriate for them. So those attitudes and how we perceive, or perhaps how family perceives, or even in a senior living community, if the attitudes are like, oh my goodness, you better not be seen holding hands with, your neighbor across the hall, those are all going to have an impact on sexuality. This is where it gets a little bit more complicated. So, please bear with me. I am not a nursing home administrator, but we do have to recognize the challenges, I think, that about sexuality in long-term care. We know that there are laws that do state that residents should have some degree of privacy, along with the right to psychosocial well-being and sexual expression. But I can only imagine how interesting it gets to try to manage that. On average, 50% of nursing home residents are diagnosed with some form of dementia, and that can make them unaware of their own behaviors. And so, there's a lot to consider when you're thinking about trying to create that privacy and that respect for people's decisions based on the fact that there is a lot of dementia that we have to manage. Some facilities or some communities could take the approach of, well, we're going to be very pro-sexuality, or we're going to be anti-sexuality when we're developing our policies and staff trainings. And it's just important to recognize that despite individual beliefs, residents who are living there do have some rights to their own privacy and their ability to explore and have sexual expression. So I can see that that would be a very challenging thing for some facilities. And I think the leaderships and the directors really have to do a great job of how they convey that to their staff, how they talk about it. And then again, let's consider that 34% of LGBT older adults worry about having to hide their identity to access or in a senior community. And I find that very sad. I'll admit my brother is gay. We talked about this the other day, and I was it was really disheartening to hear his concern over this and his fears about going back and to being a young man and having to pretend that he wasn't gay, and then his concern about being older and how are people going to treat me if they're taking care of me and they have biases against gay people. I looked at some different communities. There's actually some great resources and communities that are really supportive and really promoting senior living communities for LGBT. There's not a lot of them, but there is a movement towards that. So regardless of our own beliefs, we have to recognize that people do have rights to express themselves. I think that's just very important. Boy, we can't talk about sex without talking about STDs. It's not just for young people. Yes, it's true. Older adults are at risk. And you can see some of the statistics here, between HIV, general STDs, including chlamydia, gonorrhea, syphilis, they have reached historic highs amongst older adults in the United States. If you are on the call and you're in a senior living community, you might be very aware of this. But also 51% of the people in the United States with diagnosed HIV were 50 and older. So regardless, we know that it is common. Older adults are still at risk, just like anyone else. And obviously, when we're talking about our older adults, they have comorbidities. They're on more medications, and they could have side effects complicating the management of these diseases. We also have to recognize that there could be biases in diagnosing some of these things. First of all, the older adult probably may not bring it up. The physician may or may not recognize or have biases and think, well, certainly that can't be the reason they're having this issue because they're probably not sexually active. So, their whole issue could go undiagnosed, which could cause even more problems. But let's admit, we understand older adults are just as vulnerable to STDs as anybody else. Does not change. Let's talk a little bit more about the cognitive impairment considerations. And I think it's important that we kind of take a look at people living with cognitive impairment have changes to the brain, right? So these can result in dementia-related behaviors that some might call sexual inappropriateness. So without proper assessment, I think that person could be, labeled, oh, this person is very inappropriate, without addressing the fact that it could be the medication, it could be the dementia. So we don't want to jump to conclusions and think, oh my God, it's just not fair to think that this person is doing this on purpose. Without fully understanding the history of that person, their sexuality history, their diagnosis, what medications, because dementia-related behaviors are tied to the disease, and these are symptoms. So they could be confusing staff for a loved one. Maybe they are craving physical touch. Maybe that touch on the shoulder they're interpreting as something else because of the dementia, and these triggers could be possibly avoided or redirected in the future. So, it can go either way. They can have a heightened sense of libido, or maybe they have a lower sense of libido. But regardless, those are challenging issues in healthcare for us to address. All right. So as we're talking also about dementia, we need to talk about assessing consent. This is where it gets challenging as you're dealing with that older adult, but a couple of things that we can address or take a look at is the older adult's capacity for consent should be based on a few things. And those are those abilities to communicate and understand their choice. Who their partner is, knowing that their partner is not their spouse, if that's the case, who is initiating that sexual contact, and the state or the level of intimacy which they are comfortable with. So if you are dealing with older clients, or, even if you're in home care, you're dealing with your own family, you have to understand, does this person know, can they communicate a little bit more and understanding their choice? So asking these questions could be important. I have an aunt now who is 78. She is continually on Match.com dating different men, and it's a challenge because her son doesn't really know quite how to deal with this. And we always go back to sort of these questions. Is she cognitive and able to make her own decisions? Does she know who this partner is? Is she choosing to do this? Is she initiating? Is she accepting that he's initiating? We don't even know the level of their intimacy, but we have to understand that she is seeking someone to be connected to. And while we are concerned for her, but by some of her choices, we have to respect it. And we have defined that she is able and to consent. We also want that person to appreciate the potential consequence. For example, this relationship may be time limited. So it's no different just because you're 80. Well, maybe they liked you for a week. Maybe next week they don't like you. So are you prepared for that? Can you consent to knowing that this may be a short-term, not a long-term situation? And then again, being reasonable and rational and able to say, I'm going to set limits, and I also know what I want from this relationship. It's challenging and it's so uncomfortable, especially for families to deal with. But again, I always go back to the fact, is that person able to consent? Are they cognitive? We don't have to like every decision that they make, and we certainly want to protect older adults, but we also, it's a fine line between respecting their autonomy and keeping them safe. Very, very fine line. Again, I mentioned before, I am a gerontologist. I'm always going to come at this from the aging perspective. Being able just to have dialogue with the older adult about their choices is a good start. Providers who are working with older adults, here's some key points for you. First of all, you need to understand their past sexual health. What is normal for them? So, by asking those questions and understanding what's normal for them, you can understand that, oh, okay, this behavior is not what they had indicated before when I started working with them, and understanding their attitudes about sex. Those are all going to help you sort of understand and be able to help and support them in the lifespan by understanding their past experiences, their attitudes, and how this might affect their current situation. We have to be, aware of our body language, our words, our voice tone, that body language. If I've got my arms crossed and my head back and I'm looking at somebody saying, talking to them about their behavior sexually or whatever the situation might be, I'm expressing my displeasure at their decision. And let's face it, again, we have autonomy. We have the right for older adults to express themselves appropriately. So let's, just do our best to try to be unbiased and not bring our own judgments into this, which is difficult. And I think as we're dealing with older adults, that comes from leadership in an organization. How are we going to approach this topic? But just be aware that those things can make somebody feel ashamed for, flirting with their neighbor in the independent living or being, seen, perhaps on a dating website. So we need to be aware that our body language and our tone really do impact. And again, we want to gain an understanding of the sexual issues related to medication and really, understand, especially, in long-term care or even in, home care as we're dealing with older adults in their own homes. What is it that we know about them? What is the history? What is normal? And then that's going to help us better assess things as we go forward. Family support. Even more difficult. I don't know who has the harder job, somebody who's caring for an older adult as a provider or the family. But with that, we all bring our own biases and our own opinions. But we want to, as a family, try to balance autonomy with responsibility. Okay? Autonomy meaning the older adult has the right to make their own decisions as long as they are cognitive and able to do so. Yet we have a responsibility to keep them safe because we feel that that is our job. And I struggle with that as well. But I think, again, if we can try to find a balance there, we're going to have more success. Remember that the past is in the past, and we need to live in the present. Your mom is no longer married to your father. They've been divorced. She's got a new husband, or she's dating, or whatever the circumstances might be. We really can't. It's not our job. It's not our responsibility to deal with that. We have to understand what is going on currently with mom or dad now, and or your aunt or whoever it is, and recognize that humanity, part of being a human being, is being a sexual person. That does not change as we age. Now, there are vulnerabilities. I have a presentation coming up in October about scams, and romance scams are at the top of the list. They're everywhere. I've mentioned my aunt more than once. She does know that I reference her in these presentations, but she was scammed by someone in Africa, and she sent a lot of money. And it just demonstrates, again, her vulnerability, her loneliness, and their expertise in preying on those vulnerabilities. That doesn't mean that all of those scenarios are bad and that people should not date, but again, it's a balance. If you hear that your loved one is going on a dating site, or they started dating the widower down the street, what do we know about that? How can we address it without taking away their autonomy? And certainly it's okay, but if we're not comfortable to at least talk about it, well, gee, Dad, you've been seeing Mary for quite a few months now. Tell me about that. Do you like her? Are we going to meet her? And just being aware of what's going on, not being afraid to talk about it, but also respecting their ability. And just use your intuition and your gut, because that will also tell you if something's going on, there is a likelihood that they could be scammed. And you can't turn on anything on the TV without seeing somebody who's been scammed in some way. And you want to, definitely keep your radar up. Contact the FBI if you believe someone has been a victim of elder fraud. It's a tough job to be a family member caring for an aging loved one. But if we bear in mind everything we've talked about in terms of the importance, your mom loves you, but she also has other needs and desires, and it's just important for us to best support them as we can. And we have to remember that when somebody looks at themselves in the mirror, and I think everybody on this call today can say, gee, I don't see myself as any different as I was years ago. So if we can keep that in mind and understand that inside every older adult is a human being who has a history, who has needs, who really needs those social, intimate connections in order to maintain their well-being and live the best life that they can. And remember that aging is not lost youth, but a new stage of opportunity and strength. We are clearly headed in a different direction with our aging population. I think we're going to see some very bold and exciting ways that people are embracing their lives. It's not over at any age. It's not over till it's over. So I really hope that this presentation was helpful to you to try to just, gee, I hadn't thought of it that way. And keeping some of these things in mind as you're dealing with your own loved ones or your clients, and try to keep an open mind and support their needs as they get older to have those intimate relationships. I'll take a pause there. I've covered quite a bit. I see some questions in the chat box, so I'm going to take a look here and see if we can answer some of your questions.
Yeah, do you want me to read them out?
Sure. Do you mind? I just started looking.
No,
yeah.
Not at all. Yeah, so we have one question that says, can you discuss memory loss / capacity and sexuality? I know you touched on that a little bit, but maybe if you want to expand on that.
Well, yeah, I mean, that's probably one of the bigger, more difficult things that we have to recognize, right? Again, bad decisions we disagree with are one thing, whether it's your clients or your residents or your family. But when we're talking about dementia, it gets much more complicated. So, and there's stages of dementia, right? So, we have to understand, again, I think it goes back to that ability to consent. Talking to that older adult about their decisions. I mean, I've heard many stories, especially as it relates to senior living, where one resident had dementia, but was having sex with another person who was married, but there's all those complicated stories. It comes down to the ability to consent and following guidelines, understanding also what the laws are in your state and what you're required to do as far as, supporting not only privacy and their rights for sexual expression, but also their ability to consent.
Thank you. I think this question kind of tags on to this, but dementia is a big deal. How would a nursing facility even be able to work around that and allow sexual activity when it can be an issue of them not even knowing what they are doing?
Yeah. And I read a lot of good material on that. And obviously, I think most nursing homes should have policies in place for this. And I believe that starts with what are the policies? What are your stances? What are you required to do? For example, we're required to give people privacy and allow them sexual expression. So there has to be a policy and understanding, and there has to be education for all the staff. And as I mentioned before, some, organizations may take one stance or the other. Well, we're going to just totally go against. None of our residents should be having sex, or we're going to promote the freedom for sexual activity. But then it does get complicated because of dementia. So the leadership must have policies. They must be in place with what their states and local laws require. There has to be conversations, assessments as they come in, and dialogue with the family, things that are again, mostly avoided because it's uncomfortable, but it's necessary. So I think the policies, the training, the support, the assessment of that older adult and their history, along with medications, dementia, and what is normal for them.
Thank you. There's another question that asks, what are some of the challenges that come up with older adults who are disabled, i.e. use wheelchair, mobility scooter, et cetera, with regards to intimacy issues, and how can we better help them?
Oh, that's a great question. Well, I think all those things that that person referenced is important. So, it's supporting their ability and their desire, whatever that is. So if it is a mobility issue, what tools or what resources can we help them with? So I think it all goes back to, again, assessing that older adult's needs and what could be a barrier for them. And I think that person is from a housing authority. So that could be very interesting in terms of what challenges that they come up with. But I think it comes down to assessing, okay, I have a client who's disabled. They have this issue. And, is there an assessment I'm sure there's an assessment for activities of daily living. Where does sexuality fall into that? And how can we support it through that assessment of understanding what the barriers are and how we can best support them?
Thanks. Can you speak to how to help an aging couple who is struggling with their sexual relationship after one received a troubling diagnosis?
Gosh, that's good. Yeah, I guess it depends on the scope. So if it's family, how do you talk about it? If it's in a senior living community, but I think there has to be a willingness, for those two people to want to talk about it. And I think, part of my hope for this presentation is that we all start getting a little bit more comfortable in addressing these things with our family members and our clients. So, not being afraid to say, wow, so what does this mean? Mr. Ibarra, now you have, you have just had a stroke and that's changing how you interact with your wife. What can we do to support that? So I think, just asking the questions, having the dialogue, and again, it comes back to sort of just understanding the history, right? Where were you before this? Oh, we were very sexual. Okay. Well, what are the barriers now? Well, it's this, this, and this. Okay. Of course, that could take, therapy as well, because it's a two-sided story, right? But I think it just begins with at least being comfortable to ask the questions about the history. And then again, where do we want to go from here now that there's a diagnosis, and what might that look like, and how can I, as provider or family, best support you?
And our next question kind of dovetails on that. Can you give examples of a first line opening conversation with families that are sensitive than most regarding the situation?
Okay, let me see. Could you repeat that one more time?
Yeah, it just asks, please give an example of a first line opening conversation with families that are sensitive than most.
First line opening for a family. I guess if we're talking about perhaps, I'll just try to think of an example. I'm a case manager, and I know I'm dealing with a family about perhaps sexuality with their loved one. I guess it's, first of all, just sort of understanding and, addressing the issue. Well, dad is starting to date again. I understand that some of you are uncomfortable with this. Would you mind sharing with me a little bit more about what your biggest concerns are? And from there, if it's a situation like that, you can start to understand that, well, they're concerned because they don't want mom hurt, or they think she's rebounding after dad died. Understanding, I think, the concerns and, and where they are can start to help to formulate a plan, right? For finding, again, it goes back to that balance between, we often as family members will bring our own concerns and our own judgments to the table. Well, I don't think dad should be dating after mom died. Well, that's your opinion. What does dad think? And why are you so opposed to this? And so it all comes down to dialogue and just understanding, and then trying to find a compromise that works for everybody. And I do believe sometimes we have to pick and choose our battles.
Thank you. How do you help a senior who thinks sexual harassment towards women is just a funny joke or in a part of his personality?
So the question was, how do you help someone?
Help a senior, that thinks sexual harassment towards women is just a funny joke and a part of his personality.
Okay. Well, I regret to say that you may not be able to help that person because they have their own belief system. And perhaps somebody who grew up in an era where that was completely okay, and that's how they rolled, or that's who they were around, or they were in an environment where that was supportive. So you may not be able to help them, but if you're having to deal with that client and maybe you're offended by that behavior, then you have to set boundaries. And you have to be able to say, well, you are welcome to your opinion, but I do find this inappropriate and offensive, and I would appreciate if you didn't have that behavior with me.
Thank you. We'll take one last question before we wrap up. Should the nursing home / providers provide protection to the elderly, condoms, etc.?
Wow, that's a good question. I don't think I can answer that. I think that facility would have to answer that based on their policies, their procedures, their mission, their goals, as well as I don't think there's state laws that would have an influence on that. But I think that comes back to, again, what is our mission here as an organization? And I think that's a great question, though, and that's where I would love feedback from anybody who is in senior living, because I can imagine how challenging that is to have these conversations. But starting with your mission and developing these policies and procedures, and then implementing them throughout your staff, because you don't want a part of your staff over here treats residents who are talk about their sexuality or want to be sexual, they treat them as if they're dirty old men. And somebody over here is like, well, we respect and appreciate your autonomy. So, it has to be part of your mission and your objectives and letting residents know when they come in what your culture is like. And I think every facility probably has the right to create that based on their own, their own organization.
Well, April, thank you so much for this presentation.
My pleasure.
If you'd like to claim CEUs for today's webinar, you will be receiving a follow-up email by the end of the business day that will contain a link to the CEU application. That follow-up email will also contain a link to today's slides. Please note you have 60 days to claim CEUs for today's webinar, and please note it will take 30 days from the date of your submission in order for us to process and issue your CEUs. Thanks for joining us today, everyone.